it's Priscilla. This is my donning and doffing video. So before we got into it, I just want to say, obviously we're doing the full donning and doffing, but when you're in the clinical setting, you would check the IPC sign that is assigned to your patient in the room, and you'd see why it is needed, what the patient has, and what you'd actually be wearing. So to don, the first thing we do is we start off with hand hygiene. So this is either an alcohol-based hand sanitizer or hand rub, or just soap and water washing our hands. I'm using alcohol-based hand rub, and we're just gonna rub it in for 20 seconds or until the alcohol has completely dried. We're gonna get the backs of our hands in between the fingers, and we're gonna make sure we get under our nails as well. So 20 seconds. We do this first because obviously our hands are what we use to touch patients a lot, and we want to make sure that they are clean before we touch any other PPE or put anything else on, so we don't cross-contaminate anything. So we want to make sure our hands are clean. And then after that, and also with that being said, all our PPE is considered clean, so we want to make sure we are not touching things or contaminating those as well. So the next thing we're going to do is we're going to put on our gown. Just going to slip our hands in, and the gown covers the biggest part of the body, the biggest chunk, so we're putting this on next, just protective barrier. We're gonna tie at the top, and then we're gonna tie at the bottom, and then we're all good to go. The next thing we're gonna do is we're gonna put on our mask. We're just gonna make sure our mask is fit to our face, and if this is an N95 respirator, be sure to do a seal check just to make sure there's no air leaving as I inhale, exhale, and it is sealed correctly. And so we put the mask on next, and then to finish off our PPE for our eyes, for our face, sorry, we're putting on our goggles, and we're good with that. Next thing we're gonna do is put on our gloves. And so for our gloves, we're gonna pull them on and make sure we put them over the cuff. And again, our gloves are going on last because we want them to be the least contaminated, as this is the last barrier between us and going into the patient's room. So we want to make sure there was no potential for anything to have crossed over or to have touched something that we're now going to carry to the patient, which we are touching with our hands and our gloves. And like I said, just making sure it's over the cuff. Obviously you can't see it here, but I'd make sure this is pulled and this would be under there. And for the next glove, go ahead and do the same thing. And it'll be pulled under, and we would be ready to go to the patient's room. Okay. So now we're exiting the patient's room. The first thing to come off, yet again, would be the gloves, because they're the most contaminated thing. So we're gonna start by taking one hand, we're just gonna pull the glove from the palm side, so we're touching the outside, and we're gonna pull it. And we're gonna grab the glove with the inside, like the clean hand, and then I'm just gonna go here, clean hand under, pull this. Now they're wrapped together. We do not want anything from the gloves to be exposed. We want them wrapped together and sealed straight to the garbage. Then we're gonna do some hand hygiene. Again, same thing, alcohol-based sanitizer for 20 seconds. We're going until it's dry. And the next thing I am going to remove is my gown. I take off the gown. I'm gonna start with the top loop and then the bottom loop. We start with the top loop because we do not want to take anything that may be on our gown and bring it closer towards our head and our respiratory system. So we're going to start at the top and the bottom. You're going to pull, we're going to roll the gown away from us, and we're going to, because this is what was exposed, we want that as far away from us, roll it away from us. It's all rolled up. I'm going to put it in here. Hand hygiene again. The next thing I'm going to do is take off my goggles or face shields. The front is the most contaminated part, so when we take it off, we're going to try to go from the sides, and we're going to just take that off as well. I'll put this away. And then Hand hygiene again. And the last thing to come off is our mask, because as we take off the gown and other things can be generated into the air, and like particles from the gown and all that other stuff can be put up into the air. So we want to keep our respiratory system safe until the end. So our mask comes off last. Just take it off from here. I throw it out. And then I do one last hand hygiene. If I was in an actual clinical setting, I would prefer to go do hand washing. And we do this one more time just to ensure that we do not carry any pathogens or any infections with us, and to just be clean. And safer is always better. So I just wanted to add that the reason we do hand hygiene after every step for doffing is breaking chain of infection. So if we can eliminate the pathogen as soon as we have taken something off and keep our hands clean throughout the whole time, that is super good. We can just end that there. And then also for our practices to keep ourselves safe, so we just don't want to be carrying anything. And also self-contamination is very common and it happens easily. So like obviously forgetting, like if I take off my gloves and I just adjust my mask, I have now self-contaminated. So just making sure before each step we take a pause and understand that we need to, there could have been anything that has now been contaminated, and it's very crucial that we do not want to move that to other parts of our body, and especially our respiratory system or any open areas. So yeah, eyes, ears.